Welcome back to Showcase Pittsburgh on KDKA-TV. I'm John Klein. 9 businesses on the show today. Coming up, you can warm up and cool down in your house with USA Insulation. But right now, Dr. Ian Bulow, back from Revive Upper Cervical Chiropractic, joins us. Welcome back to the show, Doc.
Absolutely. Pleasure to be here.
You said, John, immediately asked me about kids.
Yeah.
And my reaction was, kids? Are you serious?
It's a pretty common reaction. People say, oh my gosh, you do chiropractic for children, you know? And half the time when you look at some of the medicine and procedures we give them, that scares me. You know, it's kind of the reverse, the opposite. But absolutely, the kids these days, we see a lot of ear infections, a lot of colicky babies. I even saw a kid in his early teens that had a bedwetting issue for his entire life.
And this is related to the neck, base of the head somehow.
Yeah, so the way it works is this. Ultimately, when you look at the human body, what keeps you alive and keeps you well is truly your brain. Your brain runs, it's kind of like the boss. We call the brain the boss. And if the boss isn't happy, nothing's happy. And from a very early age, these children have neck issues that go undiagnosed because, quite honestly, nobody's looking. Nobody's having the kids checked. If you think about it, when a baby is born, especially a C-section or a forceps delivery, what happens is the child is placed in the incubator and they check the heart and they check the lungs, right? And they'll check the hip joints because those are important organs. The heart is important, the lungs are important, right?
Right.
Nobody is checking the neck. You ever think about that? There's no examination done on the cervical spine.
So maybe there was some sort of strain during the birth because there's a lot of pushing and pulling and...
Absolutely.
Right.
These are all little ligaments that are very sensitive, and especially in a prolonged delivery that was very difficult, or like I said, a cesarean where there's a lot of pulling of the neck. It's not natural. I mean, a birth, natural birth involves a lot of compression, but a cesarean where there's a lot of pulling is not natural. So you're going to have torn ligaments, and we wonder why children only nurse better on one side than the other. You know, most parents don't really think about that.
Because there's neck damage. Possible neck damage.
Quite possibly. You have to go through an examination process, but the bottom line is if the child is only turning the head one way or not turning the other, or if the child is having repetitive ear infections or repetitive screaming nights or repetitive bedwetting issues, you know, a symptom or condition once in a while is not what we're talking about. That's okay. You know, the child's developing immune system, you're going to have
it's consistent.
Yeah, if you have a running nose every once in a while, that's fine. But if that baby's crying every night for no good reason at all, or if that child has chronic ear infections back and back and back, and now they want to do tubes in the ear, I can't tell you how many tubal insertions we've avoided in our office by getting these kids checked out.
This is something, so when a child comes in for an office visit through x-rays and your diagnoses, you can determine whether they might be a candidate for you to be able to help them.
Yeah, so what we encourage is we encourage people to have a baseline examination, quite honestly, as soon as possible. There may not be any need for treatment. It's just a nice way to see how they're doing after the birth process. I personally have checked all my girls from the day they were born. Not all of them needed any treatment right away, but it's nice to have those baselines. We don't normally need x-ray. In a little child, we do thermography primarily, so it's very safe. The diagnostics are very safe, and even our treatment protocols, the upper cervical adjustments, are very, very gentle. They're almost like a gentle massage almost. So there's no risk involved at all. Sometimes people have a fear of their child going to see a chiropractor, but in the work that we do in upper cervical chiropractic, it is extremely precise and it is very gentle, so it's very safe.
Once kids get into teenage years too, and I've seen my kids, you know, slouching and you know, stand up and get your shoulders back.
Sure.
Are there ways to help out teenagers who maybe played football or dance and they were injured and didn't even realize it?
Absolutely. That's probably what we see most often is young adults, whether it's in high school and college or in their 20s, that have had chronic issues that trace back to a concussion, a sporting injury, an unresolved neurological imbalance where they have chronic headaches, they have Meniere's kind of vertigo issues, they have trouble focusing in school. I even had a high schooler who had irritable bowel syndrome and migraine headaches, and he did really well. So it's either in the birth process or just kids being kids. They fall out of trees, the sled ride hits the tree on the way down the hill, all these little things, and that's why we recommend, even if it was only annual checkups, to just see how their spine is doing.
The weather's changing. One day it's warm, one day it's cold, one day this time of year, it's Pittsburgh in the spring.
That's right.
Does that affect also?
Yeah, we find especially today, we're snowing right before Easter, and what we find is that weather changes play a big role. But see, here's the deal. The weather changing challenges us because when it's hot outside, your body has to sweat. When it's cold out, you have to shiver. So drastic shifts in temperature make your body have to perform better. And when somebody has a misalignment in their neck, keeping the brain from communicating, it does not perform as well. So it's not just the allergies, it's not just the weather, it's not just the diet. We have to look inside and see how well is the body performing. If an athlete transfers from one state to another where the weather quickly changes, I doubt they're going to hurt as bad.
It's going to be a big difference.
As a stay-at-home couch potato. You know what I mean?
We've learned a lot today. If you'd like to know more, all you have to do is call Dr. Bulow at the Revive Upper Cervical Chiropractic Center. The number 724-772-7060 or log on to revivepittsburgh.com. Coming up next, we'll warm up and cool down in your house with USA Installation and Mike Madden when Showcase Pittsburgh continues.